we'll call this meeting to order. I'd like to ask Mr. Phil Potley to send our pledge of allegiance and our invocation.
Father, thank you for today. Father, we ask a special blessing on those folks that lost loved ones yesterday walking in D.C., Father. Father, help hold them and watch over them. Father, we thank you for loving us. And Lord, we ask now that you give us the wisdom to make decisions that affect the education in Levy County. All this asking in your name. Amen. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Mr. Philpott. Before we get started, for good cause, we need to change the agenda just a little bit. We're going to flip-flop items E and item D. We're going to switch places. So Mrs. Turner will become D and the employee disciplinary action will become E. Okay? And at this time, we will welcome any visitors who are here with any non-agenda item. Remind you that we can't really vote on a non-agenda item, but we'll hear you out. Seeing none. All right. Mrs. Turner, do you mind coming down?
Mr. Chair, where's our legal today?
Our legal is on his way. He is hung in traffic.
Oh, okay.
That's the reason we flipped him.
Oh,
Well,
okay.
he has to come back down, man. Our road, there we go. Tuesday morning. It has its own.
Yeah, you bet.
Do you have one?
Yes, Phil White.
Right now.
Okay.
Mr. Chairman, members of the board, thank you for your time this morning. We're here today to give you information on the renewal of our insurance benefits for 2014. We would like to do this in two parts. The first part, we're going to make recommendations for all of our benefit products except for health insurance. And the second part is to give you an update on where we are with health insurance because we are not ready to make a recommendation for the health insurance yet. So we want to give you an update and have some discussion about where we are and where we need to go from here to make that recommendation for health insurance. So if I can draw your attention to the blue packet. These are the recommendations that have come from the insurance committee. The first recommendation is on our dental and vision plans, and the recommendation is to renew with Humana comp benefits with no change in benefits or change in premiums. The second recommendation is to renew with Aflac the accident and cancer plans with no change in benefits and no change in premiums. The third recommendation is to renew our flexible spending account and HRA administration with Lockard & Williams Insurance. But with that one, we do have good news in that they have agreed to reduce the administrative costs for our FSA plans from $6.50 per participant per month to $4 per participant per month. And based on the current enrollment of 142 employees, this would save the board around $3,195. Now the reason this is coming forward is, as you know, we changed the procedures on our HRA, which is our health reimbursement arrangement. And now that HRA plan, we have given our employees until the end of this school year to spend their $255. With that plan going away, Lockard & Williams recognized the fact that their price of $6.50 was not competitive. So to entice us not to look for a new administrator. For 2014, they agreed to reduce their price, which is now competitive. When we had the HRA plan, the administration they were charging was 50 cents per participant per employee per month. And that rate is what made them more competitive. But with that plan going away, they were too high. So they have agreed to reduce their price.
And that's for 9 months, or is that for all 12?
It's for 9 months. Everything's based on 9 months.
Thank you.
We would like to make some changes in our term life insurance policy. We want to increase the plan value of these policies in the event that our employees want more life insurance. The basic life insurance, which is the insurance that the board buys, will continue at $10,000 at the same rate. The rates of our insurance will stay the same, but what we would like to change is increase the value that our employees may purchase. And it gets a little complicated, but we want to take the maximum value up to $300,000. So if they, and this would affect basically a new employee coming in, if they want to purchase $300,000, they may do that. Now, the guarantee issue, which means that they can come in and purchase this without any health questionnaire, without a physical, is going to be $150,000. If they want anything over $150,000, then they will have to go through what we call medical underwriting. But this does provide our employees an opportunity to increase their term life insurance values. For those people that are already involved in the program and buying the $40,000 max, which is what we have on our plan right now, they can increase their value up to $150,000. If they're participating in the plan currently and they purchased supplemental coverage from $10,000 to $30,000, they can increase their value up to $50,000. There's no guarantee issue for people that are not participating now. If somebody makes application to purchase insurance at any value, then they'll have to go through the medical underwriting process. But that's not uncommon. It's very common. We also offer supplemental spouse coverage for supplemental coverage for spouse, and that maximum is going to be $150,000 with a guarantee issue of $20,000. And then if you look all the way down to the last bullet, what we are recommending that payment of all life insurance premiums be outside the cafeteria plan. Under the cafeteria plan, and the reason we have always had our $50,000 limit is that's as much as you can do in a cafeteria plan. And what a cafeteria plan is the pre-tax portion of the plan. So as long as people are paying premiums under a cafeteria plan, that means their premiums are pre-taxed. But under IRS guidelines, term life insurance cannot go over $50,000. Otherwise, it has to be an after-tax premium payment. So because of the low cost of these plans, this is not going to be significant to our employees. So changing all of our life insurance from a pre-tax payment to an after-tax payment is part of the recommendation. The next recommendation is regarding the disability plan. We have not had a disability plan. When I came here 21 years ago, we had a disability plan in place, but it was kind of phasing itself out. At the time we were looking at this 21 years ago, we had 2 people living on the disability plan. Our new consultant, Don Crook, indicates that this is a place where he saw our plan lacking. So we went out and received information and we are now recommending that we put a disability plan in place. And I have given you information regarding the plan that we're recommending, which is the Aetna plan. And Aetna specializes in educator disability plans, and this is the reason that this particular plan was chosen. And what this is a plan that our employees can design for themselves, because there are choices in this plan. If you'll look at the first page where it talks about long-term disability, rates, premium, and plan design, one of the most important features of this plan is the elimination period. And by elimination period, the employee can determine how long they can support themselves without help from a disability plan. So if an employee has enough savings in the bank that they could go 14 days without income, then they can set up their plan for a 14-day elimination plan. And then on that 15th day, they will start getting disability benefits. And disability benefits are going to be paid for any disability, whether it's a disability caused by workers' comp, whether it's maternity, any kind of disability, whether it's personal, accident, illness, whatever. The maximum monthly benefit is $7,500. So that $7,500 would cover our employees with salary replacement if they have a disability. This is a voluntary plan. It's there if our employees want to participate in it. We are hoping there is a minimum enrollment. And when I asked the consultant about that, he kept telling me not to worry about it. And I said, well, what if we don't get enough people in it? Don't worry about it. So we are anticipating, or we're hoping that we have enough participation that we can move this plan forward.
Just don't worry about it.
Just don't worry about it. So, and I'm going to leave that up to our consultant, because he's the one that told me not to worry about it. So we would like to move forward, though, to see if there is interest in purchasing disability plans.
Those rates are 9-month rates.
Yes. Yes. The last recommendation from the committee is regarding health insurance, and this is the only recommendation we're making about health insurance today. But we are recommending an open, whatever we end up doing in insurance, we're recommending an open enrollment for January 1, which means that any employee that is not currently covered under health insurance may enroll in health insurance and participate. As of January 1st, 2014, under the Affordable Health Care Act, all pre-existing goes away for adults anyway. So anybody will be able to come onto our plan under this open enrollment and participate without any pre-existing condition exclusions. And actually, from 2014 forward, whether we have an open enrollment or not is pretty much going to be a moot point now that the Affordable Health Care Act is saying there are no pre-existing exclusions. So, but we'll face that as we move along. The Affordable Health Care Act is creating a lot of confusion. It's creating a lot of questions, and we are learning, or trying to learn what we need to know. Problem is, Washington doesn't know what they're doing, so I'm not sure how they expect Levy County to know what we're supposed to be doing. But I have spoken with the superintendent, and I think we agree that the Levy County School Board is not going to be a source for information on the Affordable Health Care Act. We are getting calls from employees. I had no less than 6 calls just last Friday from employees who are getting information about the Affordable Health Care Act, either through letters or emails. I have people who want to come in and give information to our employees and to our parents regarding the student coverage. And we do not feel like we need to be that source of information. That there's plenty of other sources, and we're also finding out that there's going to be a lot of fraud and abuse already, because we don't know what sources are legitimate and what sources are not legitimate. And we don't want to put the school board in a situation, a liability situation, where Donald Turner tells somebody that this is what they need to be doing, and it turns out to be totally bad. So we are just determined that we are not going to be that source of information for Obamacare.
We are not a sales organization, and we don't have the time to filter out those that are pushing sales. And we are also getting a lot of public record requests for information about all of our employees, which no doubt is tied to them, companies wanting to gather information about our employees so that they can push their sales on. And so but in order to safeguard the board, we do not need to be trying to decipher what the federal government is trying to say as they change the law on a daily basis. And we'll let them and companies worry about that, and we'll just try to do our best in providing insurance for our people. That's all we're doing.
Mr. Chairman, that completes the recommendations from the committee. If we could request the board to act on these recommendations, then we would be able to move forward in setting this up for our enrollment.
Any questions for Ms. Turner?
Just on this disability stuff that you're reviewing.
Yes, sir.
What's the time frame on enrollment for that? So if we go with that, right?
It would be, we would include it in our regular enrollment process, so we would include it in, as soon as we have all of this put together, including the health insurance, then we will get all of this information out to our employees. So enrollment would take place in the schools during our annual enrollment in November, for a January 1 effective date.
And then what, for the health insurance that you're still looking at, then what are we, we're having meetings, what are we doing on that?
Okay, if there are no other questions about this, then after,
We'll get to that. That's the exciting part.
that's the exciting part.
I move we accept the recommendations of Ms. Turner.
Second.
Motion and a second. Any further questions? Seeing none, all those in favor of the recommendation say aye.
Aye.
Any opposed, say no. Motion carries. Now the exciting part.
Actually, it's not really exciting, it's more distressing than it is exciting. If you will take a look at the packet that I gave you that starts with the yellow sheet. This yellow sheet is information we receive from Blue Cross Blue Shield that we get every year that outlines our experience. It outlines our high-cost claims so that we can see where Blue Cross Blue Shield made the determination about our renewals. On that first page, I highlighted for you, currently our claims experience is running, or as of July 2013, our claims experience is running 84.34%. And that's fairly significant.
What does that mean?
That means that 84.34% of the premiums that we paid in went to pay for claims. If you look at the second page.
Wait, let me ask you then on this, where it says that 916%, that's what it was in June.
Well, you really can't pay any attention to those particular numbers because if you remember, we're on a 9-month premium. So in June, July, and August, we don't pay premiums. So for those 3 months, they're not showing any premiums coming in, so that 916% is just the claims that were paid out.
Okay.
Okay, so that looks terrible, but it's really not significant.
Okay, all right, thank you.
Ms. Thompson, ask one more question.
Certainly.
That paid out part, is that That's everything, that's like drugs and
Yes.
operate, there's a whole ball of wax.
That's everything, that's doctors, that's inpatient, that's drugs, and actually, unfortunately, you can't see it real well, but all of those numbers are broken down. If you'll look at that top shaded in section, it tells you exactly how much was paid for facilities, physicians, outpatient, inpatient, and drug care.
Do we have a comparative of this from last year's expenses or last year's percentage too?
Yes, yes. Last year's percentage, I believe, was around the 67% mark, because we didn't have a significant increase last
We
year.
did track it year to year,
We did.
and it is higher.
Any more questions on that sheet? Okay, if I can bring your attention to the second yellow sheet. This is our high-cost claims, and high-cost claims is anything over $50,000. This is the first year ever since I have been doing this that we have had 12 high-cost claims. And these 12 high-cost claims generated almost $1 million in paid claims. So we were at $972,000 in claim, in paying these 12 high-cost claims. This is another significant area that Blue Cross Blue Shield looks at. Now, of course, we don't have any clue about who these are, and it doesn't really matter, because the purpose of insurance is to take care of those that need that coverage. So it really doesn't matter, except that Blue Cross Blue Shield looks at these. They will look at these to see if maybe there's one that's an anomaly, that it's a one-time thing and may go away. But the other thing they look at is this going to require ongoing care. So this filters into the calculation when they're determining what our renewal rate will be. The other part of what Blue Cross Blue Shield considered this year was Obamacare. We have to pay fees effective January 1. We have determined that 4% of our increase came as a result of the calculation that Florida Blue did to cover the fees that's required. These particular fees are fees that the federal government is using to set up their exchanges. So all group health plans are paying these fees. There's another 4% that Obamacare is requiring because they are telling us what kind of benefits we have to include in our plan. And when we included those extra benefits, then Blue Cross Blue Shield determined that it was going to be another 4% increase. So based on our claims experience, our high-cost claims, our 4% in fees, and our 4% because of the extra benefits that the government thinks we need, then our renewal rate came in at 27.8%. So that was a shocker, to say the least.
Is this something that every district in the state of Florida is facing?
Well, as far as the fees are concerned, yes, sir. Now, of course, they may have lower claims experience, they may have fewer high-cost claims, which allows them to have a less of an increase. Not everybody in Florida is getting a 28% increase. But based on everything that came together for the Lee County School Board this time, that's where the renewal came in, with 28%.
Those that are not self-insured would average in the 20% range. And there's some that's up in the 30s. In fact, the Levy County Sheriff's Department came in at 31 point something. So this is not an extraordinary amount increase, but it certainly is a lot.
The 8% so is everyone.
that offers these plans, right? Because of the fees and the extra benefits.
That's correct. And what we do not know, and what we will probably never know, is there any percentages stuck in that 28% or 32% or somebody else's 12% that is a result of the insurance companies? The insurance companies are losing individual markets. In other words, they cannot or will not be writing individual policies. So they're losing money on that individual market. So where do they make it up? They're going to make it up on the group markets. So we won't know, if any of this was bumped up just a little bit to make up the difference in what insurance companies are losing from one market to another.
And this doesn't discuss anything to do with the fines that we will be facing. The Obamacare plan is set up to fine us a tremendous amount of money over the course of the year. We get fined for people that don't carry insurance. We get fined for people that go out and get supplement insurance. We will pay a tremendous amount of money in fines through Obamacare.
Okay, so let's move forward.
Can I ask one question about that yellow page?
Yes, sir?
Like that number of, I guess that's prescription on the far right-hand side? Is that what it is?
Yes, sir.
So
Yeah,
that,
but that's not necessarily just prescriptions. That could be anything that will fall under prescription care. If people's in the hospital, if folks are in the hospital, then there's a lot of those things that fall under prescription care that might not be just them going to the pharmacy and buying a prescription.
What's our average run on this? Like, we're 12 this year, but historically, what have we been in the past?
Last year, and this is just a guess, Mr. Howard, it seems like it was around maybe the 500 mark, maybe a little over. Any more questions? Okay, if we could move forward to the spreadsheet. Anticipating that it would be very difficult to cover a 28% increase either for the board or for our employees, we have started looking at alternatives to, and the 28% would be if we were renewing our policies just as we have them today, with no change in benefits, which right now we offer 3 plans. We offer a $1,000 deductible plan, a $1,500 deductible plan, and a high deductible plan that's compatible with a health savings account. So those are the 3 plans that we have right now, and if we kept those, it would be a 28% increase. And we've given you the outline of the current plans on this, as they are right now. And then next to that, we've given you the current plans with the 27.9% increase. And I've highlighted for you at the bottom what the cost out of pocket for employees would be for each of those plans. And then the next highlighted area is what the board is providing each employee to help purchase insurance. The third column, the one we're calling alternative plans, are plans where we went back to Blue Cross and Blue Shield and said, okay, give us something different. 28% is not acceptable. So they have come up with 4 alternative plans for us to consider. We have looked at these plans, but we have not gone to the committee yet to decide, in the event that we have to go to alternative plans, just which plans we will recommend to the board. So that will come a little bit later, but we wanted to give you an idea of what we would be looking at. That very last column that has absolutely no information in it is really what we want to talk to you about today. And this has to do with the Levy County School Board going self-funded for their medical plans. We have been doing a lot of research, and we are right now waiting on numbers from our consultant about whether going self-insured is a viable option. Going self-insured, number one, eliminates some of the requirements under Obamacare. There's some taxes in Obamacare that we would not be subject to. Some of the plan designs requirements we would not have to follow. Now, I'm sure the first thing that runs through your mind is what kind of liability does that provide to Levy County School Board? Well, that's what we're having to figure out, but it's not what you think, because what we will do is we will go and find reinsurance. So we will decide how much we want to self-insure up to a certain level, let's say $150,000. Then we go out and we get bids to cover anything over that $150,000. So we would be paying a premium for what they call reinsurance. And what we would like to do, if the numbers come in and our consultant and administration believes that this is a viable option, then we would like to set up a workshop to bring in our consultant and his group to do a presentation to the board, because this is a very big decision. And we would like to do that in a workshop setting if the board would agree, because it's more, it's a little more casual, it's a little more relaxed, where conversation can flow easy. And we would like to do this prior to the October 8th meeting, when we need to bring you our final recommendation. Now, I actually have 3 dates that would be where our people could come in and do this presentation, if I may give those to you for consideration. We have Thursday, October the 3rd, Friday, October the 4th, or October the 8th prior to the board meeting.
So we would have a workshop prior to the board meeting and then make the decision at the board meeting.
Yes, ma'am. We need a decision from the board by October the 8th, unless something totally falls apart, for us to be able to get prepared, to educate, to have time to educate our employees, and to get our insurance packets out and all this done before the December 1st deadline.
And you said the 3rd, 4th, 8th, right?
That's right. Thursday the 3rd, Friday the 4th, or prior to the board meeting on the 8th.
It's going to be a lot of information to take in. I would think that the third would be the better one. That would be a little bit more time to study on that. I think it is. It's a lot.
I have an appointment, depending on what time, on the 3rd, I prefer the 4th.
The time is entirely up to you. We will set it up with our people whenever it's convenient.
What were the days again?
The 3rd.
The 3rd is Wednesday, correct?
No, you go to 12, you're on 12, here, let's go to 13.
Mr. Delaney, did you have any questions?
13.
Yes. Yes, ma'am. I was just going to say, I was at the Florida School Board Attorneys Association meeting week before last, and we had a presentation from an outside consultant who assists government agencies with a Blue Cross plan and also self-insured. So he didn't really have a bias one way or the other. And his recommendation was towards self-insured, and he said a lot of districts are going in that direction for the reasons that you've outlined. So it probably merits a close consideration.
Yeah, I've been thinking about self-insured for about 3 years now. And like I said, a lot of the districts are going that way. Flagler, St. John's, Citrus County. And of course, our consultant works with Citrus County too, so we got a close ally there that can tell us the pros and cons. But anyway, it's something that we certainly need to consider.
I think this is going to be the future of healthcare, and especially with even with the Affordable Health Care Act. And I think this puts more control in the district about what we offer and how we offer it.
I personally don't like to have a workshop and then make a decision. I really like to think about it and then ask more questions and go over it. So that's just me. So I'll go work with everybody's schedule, but this is pretty big and, you know, right before, I need more time to think. That's just me.
We understand.
Okay.
And this is the reason, we're giving you certainly more options.
Which would you prefer, the third or fourth?
But either one, I'll just schedule it in, whatever works best for everybody.
If it needs to be the third, I'll,
What time's your
would you
appointment
do?
so that we could,
10.
So something in the afternoon, or would 2 o'clock in the afternoon on the
I mean,
third?
if we need to be on the third, I'll reschedule it, so it's a dentist appointment, so it's just one of those. You know how difficult it is to,
Yes.
and how far in advance these
Yes.
people are, so.
But if you think 2 o'clock in the afternoon,
2 o'clock is fine with me, so.
Commissioner Delaney has a conflict.
I do, I've got to be in Jacksonville probably for most of the day, apart from St. Johns County, but I'm wide open on the board.
we do it
Or we can
morning,
make sure to have somebody from your house here.
or maybe a morning on the 4th? Is that open for people? Or?
I'll be wide open on the fourth.
So Friday is just a rough day on me, first of business, that being the first Friday. But we'll make it happen, whatever.
I feel like Mr. Delaney needs to be around.
Yeah. Whatever. Whatever works.
How long's the workshop? How long am I going to take?
I would schedule a minimum of an hour.
I
So you-
figure you can count on 2.
Two, Cameron?
From what I saw the
Yeah.
other day, it's gonna be a big, because this is a lot of information, lots of questions and options.
Okay, I'll make a proposal, and this, y'all have to, but I would suggest that 10 o'clock on the 4th.
Go earlier.
We could, but we have to be concerned about people coming in on a plane from Texas too.
Plus, if we go at 10, Mr. Hastings can get provide lunch.
I would be glad.
Mr. Hastings, any time, we can make that arrangement.
Okay. They do 5 o'clock in the morning.
That's perfect. That is good. And we can all jog and talk about it. That's great.
You go cook breakfast at the restaurant and then
I'll get over that.
So let's go with the 10 o'clock.
It's good.
You two fishing gentlemen, is that okay? No?
I'll be there when I told you.
So we'll have that workshop on the 4th. on 10 o'clock.
Friday, October 4th, 10 o'clock.
Here at the
Okay.
boardroom.
I will make those arrangements.
I
Now,
like those ribeye steaks too, for lunch.
now there's one more part of this self-insured plan that will be brought to your attention when we do meet, and that has to do with a wellness center. And a wellness center works extremely well with a self-insured plan. And what that is a center that we set up with a physician, which provides free visits for our employees who want to visit at the wellness center. And of course, that takes funding. And we are working on some of those options now as far as funding. Another part of the self-insured plan is we have to have somebody that administers the claims for us. And we are looking at Florida Blue to do that. We've had conversations with them. We're already getting quotes back from them on what happens. And should we go that way, and should we keep Florida Blue, our employees will not see any difference in their claims administration. What they have to do will not change at all, and that's one more part of this that we would like to keep as easy as possible for our employees. So it's a big step for us, but we'd like to keep it as simple as possible for our employees to deal with. But the Wellness Center will be discussed, and hopefully by changing some of our plan design, we will save some money, which will help in that funding. So we're going to be working toward that end. The Wellness Center itself can do several things. It can also help us with our workers' compensation claims. So we will be sending our own employees to our own wellness center for treatment, which means we're going to be saving money on workers' compensation. It also can be utilized for bus driver physicals. So we see a lot of benefit in this as long as we can come up with a mechanism to fund it. But that's just one of the other things that this group will be discussing with you. One more thing, if in the event self-insured doesn't work, if we look at this plan and just say, I just don't think this is going to work for the Newton County School Board, then we are going to have to go back to option 2, which is looking at our alternative plans. And should that happen, I am going to go ahead and request a meeting of the insurance committee again for us to consider what our recommendation may be under the alternative plan option in the event self-insured doesn't work. So we will have that prepared and ready for you on October the 8th. I included a little form for you. I did some investigation with some of our other districts just to see what they were doing and how they were accomplishing and providing coverage for their employees. I sent out 14 requests and I got 6 back. But this just gives you an outline. Under Nassau County, there are fully insured groups with Florida Blue. They do not have a plan that's paid 100% by the board, that all employees at the minimum participate with $10 a month. Their plan that they offer, their base plan, is a $2,500 deductible high deductible, $2,500 high deductible plan. In Hernando County, they have really good insurance. They have a PPO plan and it's a $250 deductible, and I don't know of any other school board from Central Florida up to the north that has a $250 deductible plan. Union County, their base plan is a $5,000 deductible plan. In Putnam County, it's a $1,500 deductible plan. Columbia is a $2,500 high deductible plan, and I didn't get any details from Blackford. But I just want to give you a little bit of an idea of what other districts are having to do to provide that base coverage for their employees.
What was it provide?
Sorry?
How much I mean, what help was that?
Our base plan is the $1,500 deductible plan, but that may have to change for us to be able to afford it.
It's kind of like Putnam here.
Yes, sir.
Thank you.
Any other questions? I will set things up for Friday, October the 4th, and provide that information to Pam to confirm that. Okay, thank you very much.
Thank you, Mrs. Turner. All right, we'll move on to the employee disciplinary action. Mr. Basil.
Thank you, Mr. President. We go from the exciting world of insurance to the very sad world of employee discipline. This morning I bring to your attention Isaiah Parker. who is sitting in our audience. I have reason to believe that Isaiah had a lascivious and intimate relationship with a 15-year-old girl. There's an open investigation by the Sheriff's Department as to his actions. Isaiah applied for a marriage license, saying that he was the father of this girl's unborn child. Then after finding out that he could be doing a tremendous amount of jail time, he recanted that he was not the father. He took at least 2 trips to Puerto Rico with the young lady and her family. Therefore, I'm asking the board to terminate Isaiah Parker's employment. I'm going to pass out to you 3 pictures that's only for your, to be viewed by you, because it also has pictures of the young lady. And so the audience would not be privy to this. Mr. Parker, you got something you would like to address to the board?
I would like to address on his behalf that he received a letter from the administration that at this meeting, he would be recommended for suspension without pay. It did say because the investigation was not resolved. I do believe, Isaiah, that he has not committed a crime and he is being investigated currently. It hasn't been resolved. So I'm a little confused about why you're recommending for termination when you wrote in his letter that you were recommending for suspension without pay.
At that point in time, I wasn't sure whether he was going to, because we did not give 24-hour notice for him to come in, if it's going to require another meeting with union representation, but he decided to waive that second meeting to come to this meeting. That's why there was a little bit of confusion about that.
Any questions?
Mr. Superintendent, there has been notice of this meeting, there's notice to the employee pending discipline. He's here, his union representative is here. They have an opportunity to be heard if they wish to.
Well, and my concern is that he was going to be suspended without pay until this was resolved, this investigation was resolved.
Well, that's not the investigation as to whether he's the father of the child or not. is not the ultimate factor with us. The ultimate factor that we are moving forward with is, did a 29-year-old employee in a supervisory position have an intimate and lascivious relationship with a 15-year-old child? That's what we're dealing with, not the point whether he is actually the father or not the father.
It's my understanding that this came to light because he applied for a legal marriage license with parental consent to marry his girlfriend. And that's how this investigation began.
That's my understanding too.
So, since it's legal in the state of Florida, it will be appealed if he's terminated.
That is, certainly your prerogative, but it's our prerogative to decide whether a 29-year-old male employee can have a sexual relationship with a 15-year-old child. That's our prerogative.
First, she's 16 years old.
She is 16 now. She turned 16 on July the 22nd, but that was subsequent to trips to Puerto Rico and other intimate relations.
Well, this is going to be investigated. I wasn't on that trip to Puerto Rico, and neither were you, and so we don't really know what the nature of the relationship was at that point. But that's all I know.
Superintendent, if I may, based on my discussion with Christine, we went through the board policy. There were a number of provisions that were implicated. She may have those to specifically enumerate. We can certainly provide that if it's necessary. But certainly, it's the kind of thing that someone in a supervisory capacity, it was not appropriate for them to have a girlfriend who is a teenager. And if it does turn out that the sheriff's investigation determines that he is the father of his child, as he is represented in his sworn court document before he recanted it, that's subjects him potentially to a statutory rape charge. And I think that was the district's concern. So girlfriend is the operative term here, regardless of how the sheriff's investigation resolves itself.
Is she a student?
Technically, she is. She was a student last year with us. This year, she is a student at a private school, but she is a McKay scholarship student. So, therefore, the funding for her education comes through this office.
I don't know anything about this. I've heard the reference of 15, 16. Could you being an attorney, what is it? What is the significance of that?
I don't think it matters when you're dealing with somebody who's 29 years old, whether they're 15 or 16. The judge, to my understanding, was in that hearing, the judge who was receiving the application for a waiver of a marriage license recommended that the state attorney open up an investigation on this file when he heard what was going on. And that's what brought it to our attention initially.
Isaiah, would you be willing to answer questions if any board members have questions?
It may not be to his benefit because
We don't want to
Not
have
this
any more
time.
problems.
he's got 4 issues to attend to that this is.
Okay. What's the wishes of the board?
Is that a recommendation from the superintendent?
The recommendation is that the board terminate Isaiah Parker employment immediately.
Move approval of the superintendent's recommendation. Second.
We have a motion and a second.
I'd like to just say her comments that this is pretty serious and this is pretty terrible, and I'm really sorry that we have to have this brought to our board and something like this has happened in our school system, that we have somebody that's in that position and this is happening. It's, to me, that's very embarrassing.
The information we have, Ms. Dean, is that there has definitely been violation of board policy. The council alluded to it a few minutes ago.
Ms. Dean and I went through it. There were 3 provisions, I think, that we were looking at. Certainly the kind of conduct that brings the district into disrepute, putting the safety of students or children, at issue. And there may have been one other.
There's one other.
For the record, could you give us what those are?
And while she's looking for that, and there is no denial that he is in violation of these policies.
The only denial that I'm aware of is that he is the father of the
I'm sorry, I maybe didn't make that plain, but we're certain that he is in violation of these policies.
Yeah, and I think the photographs will bear that out.
Okay. So which policies we were referencing at that time?
Under School Board Policy 6.11, suspension and dismissal, Part 2, standards of conduct, we were particularly concerned about Subpart B, any action which brings the school system into disrepute. Part D, dishonesty, including falsification of any personnel or any school system forms or documents. These are the documents that were submitted to the court. Part G, harassment of a student or fellow employee on account of race, sex, natural origin, religion. Part H, immorality. Part M, misconduct in office. Part T, Part S, non-compliance with regulations and policies of the board, State Board of Education, and laws of Florida. Part T, any other misconduct prejudicial to the interest and or reputation of the school system. And Part U, it endangers the health, safety, or well-being of a fellow employee or a student.
I have one other comment. From my perspective, I have been involved in a situation like this in another district a number of years ago. The way that was handled very simply was the participants sought permission before doing anything, so that everyone understood that this was going on, and the parents had agreed that they could date or whatever before anything. I've been made aware of nothing of the nature of this was going on. So evidently permission was not sought by this employee to do this. Not saying that we would have agreed, but I would have felt a lot better. So, permission was not sought.
It was not solved, but I have a real problem with 29-year-old.
Well, as I said, that's why I was just relating as previously. It happened, evidently the parents are not having an issue with it, but it is still a violation of policy.
It's also a violation of the law.
Yes, sir.
I wish Mr. Parker could answer this question. It's a heck of a spot, but what it boils down to with me is, haven't seen the pictures. Those are not racy photos of anything going on. To me, the photos do not show that taking away any kind of object. You just saw the photos. That could just be family and friends that visit. But when you throw in, you have a 29-year-old man, 15, 16-year-old girl, 29-year-old man who happens to work for the school system who is dating, possibly. You don't have an answer to that. possibly dating a 16-year-old student, we can't have that. That's the very thing that makes the news every day, and people just very outraged at it. If you know it going into it, it's something that you're aware of, weren't they aware of it? And because Mr. Parker cannot answer questions at this time, we do not know the details of the intimacy of the relationship. We don't know if this is just a fellow falling on the sword because a girl has had a bad situation happen. We don't know if they are into it. But ultimately, we cannot have a 29-year-old employee dating a 15, 16-year-old young lady.
And like I said, Mr. Aswell, I mean, on the news, you know, teachers get in trouble all the time. You see it with young students and everything, and
Well, this morning-
that's obvious too.
This morning, they were talking about the teacher who had a relationship with a 14, 15-year-old boy.
Right. And they were terminated.
And they were in the jail.
Yeah,
I
that's
hope that's not the case. Now, may I ask one more question? If the process goes and goes to the state's attorney's office and all that kind of stuff, and it is found that Mr. Parker is not father of the child, did not have an intimate relationship with this person, what happens then as far as the board is?
I think that he could potentially reapply and his application would be considered. I think the board's concern right now is that there's evidence that indicates that Mr. Parker is involved in some type of a romantic relationship that began when the child was as young as 15. My recommendation when I heard about this, that this is a mandatory reporting event to the state on the child abuse hotline.
It is under investigation by the Department of Children and Family Services as well as the Sheriff's Department.
The parentage of the child is not the district's ultimate issue.
It is the relationship between a 29-year-old man and a
Inappropriate
16-year-old
relationship.
young lady. Any further questions, comments?
Well, my concern is, like Mr. Green said, is that the judge brought that out too. You know, that's a serious concern. Another serious.
And even if no progeny is involved in it, it's still not right.
That is the point.
In my opinion, it's still not right.
I'd like to still reiterate to the board of this, that this morning, we can make our decision based on our board policies, which have been violated.
Absolutely.
Disregarding the legality of the fatherhood, non-fatherhood, relationship, whatever. Our policies were violated to the extent that we can find.
Any further discussion?
Call the question, please.
All those in favor of the recommendation, please say aye.
Aye.
All opposed, no. Motion carries. We'll now move on to F, District Strategic Plan. I'd ask Dr. Neck, are you starting or is Carol?
Here we're going to leave the discussion today.
Good morning, Mr. Chairman, members of the board, Mr. Superintendent, and guests. Just before we begin, let me say Happy Constitution Day. The U.S. Constitution has 4,400 words. It is the oldest and the shortest written constitution of any major government in the world. So, just a little
Must have
note.
been a history teacher.
I just couldn't pass it by. I'm going to talk to you a little bit about the strategic plan, the layout and the process. Dr. Winnett will step in and talk about the strategic plan and how it ties to our district accreditation. We have had a strategic plan in this district for some time. I will say that when Race to the Top came about, and we've got it documented in a lot of our agendas from our instructional time, that we set aside the strategic plan revisions and updates to get through Race to the Top, and we allowed Race to the Top sort of to guide us. And what we have been able to pull together is a strategic plan that aligns all of our documents, our district improvement plan, our district accreditation, and the state strategic plan. So what I'm going to do, you got a copy of this last week, and I will say we've made a couple of corrections since then, so I'll point those out when we get to them. But the first thing I want to do is just sort of explain the process that we've gone through and the layout, and how to maybe work through this document so that it will make sense to you. Linda Durtz and I began working on revising and updating the strategic plan back in April. We met with lead teams from each school in this room, and the lead team was able to take our mission statement and add their suggestions. The mission statement that we had in our strategic plan was created by the instructional team at the time, and was also the entire faculties of Levy County had input into that mission statement when Mike Todd was here. I don't know if you remember Mr. Philpott getting the many emails from Mike Todd about the mission statement and the verbiage. After a lot of input about the mission statement, we agreed to make the mission statement very simple. And what is our purpose? We want our students to be safe, and we want them to be placed when they graduate. We want them either working, in the military, or in college. So that's pretty much our goal. So we simplified the mission statement based on all the input and the feedback that we have received over the last couple of years. And more recently, from April, we received input from our lead teams. So what we did is we have a layout. Let me just kind of share with you the page where it says mission, Levy's mission and Levy's vision, and then the guiding principles. The 4 guiding principles, so if you're on the 3rd page of the document, the 4 guiding principles are the state's strategic goals. So the state says that we have 4 goals, and there's the 3rd page that you should be on, and it says guiding principles for Levy's vision. So the first strategic goal that the state has is highest student achievement. The second strategic goal that the state of Florida has is seamless articulation and maximum access. The 3rd is skilled workforce and economic development, and the 4th is quality efficient services. So the state has 4 strategic goals. Anytime we fill out a grant application, whether it be the Carl Perkins grant that I have to do, or any of the title grants or the K-12 reading grant, somewhere in that grant it says which state strategic imperative will you be addressing. So here's the 4, okay? So the state of Florida says we have to have these 4 goals, and that's where we worked from to begin with the strategic plan. The next page that Dr. Winnett's going to go over a little bit is we wanted to tie what we're doing with the district accreditation into the state's strategic goals, okay? So we were trying to combine some documents so we don't have all these separate things. Does that make sense? So far? So then you get to page 5. So here's our first goal with the strategic plan, which is highest student achievement. On page 5, I want to draw your attention to a bullet that we added that is not in your copy. Well, it wasn't in the copy that you got last week. It's in today's copy. Highest student achievement. What are we doing to reach that goal? With input from one of our business partners, Denny George, some of you know him, he's with Duke Energy. He was able to work with me and provide some feedback. So we added the bullet that you did not get last week in your packet, but today I want to just draw your attention to that. And under students working to achieve high standards, you've got curriculum, instruction, and instruction focuses on critical thinking and problem solving. The last bullet, Denny George, and I don't know why being the career tech person that I didn't think of this, I feel a little bit embarrassed, but Denny George says, well, what about including how your business community partners come in and make relevant and stimulating presentations to engage students in critical thinking? And we know we've had them do that a lot. Denny's been involved in that. Jeff Harris from Tarmac is involved in that. Ryan Watson at Central Florida Electric has been doing that for us. They work extensively with grades 6, 8, and 10 in their algebra classes and in math classes over the last few years. So I was like, you're right, we do that. We have guest and business partners come in and engage students in activities that stimulate critical thinking and problem solving. So that's new from what we got to look at last week. Okay? So these are things that we're doing to work to get students to achieve at their highest level. All right, so we're looking at curriculum, we're looking at instruction, we want instruction to promote critical thinking, we're looking at educating the whole child, everything, and providing those resources. We use data to drive our instruction, and we have teachers work and administrators working collaboratively. On page 7, you see our data. So page 7 is the data that goes with that first goal. Student highest achievement. We have our baseline. That data is our baseline data. And the targets, you can see at the bottom, the targets are AMO targets that come from the state of Florida. And the state of Florida has projected out for us where we should be. All right, so those are projected targets in 2016. Seamless articulation and maximum access is the second goal. And you will see we've got some data charts in this area. Digital learning, this is an area where Barb Rivers and has been providing a lot of assistance, and Ron Perez, where we're at with our bandwidth and all of the discussions that we've been having about bandwidth and bring your own device. Also promoting families as partners and accelerating coursework. So you see some more data on the bottom of page 9 regarding accelerating coursework. So all of this goes with the second stage strategic goal, seamless articulation and maximum access. Yes, sir.
GPPS.
Sorry.
Megabits per second?
Are you on the chart?
Megabits per second?
Oh, on the data. Yes. That is yeah.
That's the amount coming through per second.
Okay. Yes, sir. Third goal.
No, ma'am, I have a question,
Oh,
but
yes.
I don't know exactly. Can we go back to the mission?
Absolutely.
What would be wrong with saying or instead of and?
What about the C?
Pardon?
What would be wrong with saying or rather than and?
And or college and or career ready.
Yes, ma'am. Because how about folks not going to college? I mean, what the deal, I don't understand that. Everybody don't want to go to college.
And I think that the state probably uses that word college in reference to any kind of post-secondary. But, and you're right, not all of our students have to have some kind of post-secondary. Although I think.
Definitely helps. I mean, I'm
Yeah.
not saying that doesn't help, but.
Right. That or would be fine. And that's why we're here today to get your input. Because
I think it needs a and or be career ready.
And or be career ready.
Something, because to me, it's just a weird sound. I mean, it may be being the uncollege graduate sitting here, man, who chose not to graduate college and went into the workforce.
Right.
Yeah, he does.
But did you have training?
Yes, but what I'm saying is when you read that mission statement, our mission for all students to be educated in a safe environment and to graduate college and career ready. It's not a good,
Our mission is for
I
all students.
may be the only college graduate in the room, but even I got sense enough to go, that don't sound like a good sentence. My fifth
Our
grade English
mission is
teacher
to
said
be,
it got
our
to be
mission
better.
is for all students to be educated in a safe environment and to graduate college and career ready.
Some don't sound right there. I'm being serious.
And
It
be
does not.
career ready.
And or be career ready. Something's missing, and it may be the fact that I graduate college, that may be the way college does. I'm grateful right that way. I did not. It sounds like something's missing.
The thing that aggravates me is the fact that it's like, when you, like your little robot in first grade, you little boy, you gonna go to college and you gonna graduate. That's not true. That's not true.
That is absolutely not
I mean,
true.
there's nothing wrong with that. I mean, it's a wonderful goal, and I think it's great, but it's not gonna happen.
All right, so
I think
I'm sorry, I mean, I'm not trying to.
No, you're fine. Like I said, we have gotten input from a lot of people.
And I just think the
And we
sentence
want your
sounds
input too.
like something's missing there.
We could, you know, I think we need to do a slash or, you know, something,
And or,
and or.
I think it needs to be and or be, probably career ready.
So you know, if I were a Levy County student that have no idea I'm going to college, I read that turned me off completely right there. What am I doing here? I'm not going to college.
See, there's a lot of colleges that prepare you for a career, you know that, but you can also have a career without going to college, so and slash or. Could be and career ready, or could be or career ready.
all right, we will take this back to the revision board.
It means something. It means something.
Okay.
And I'm not trying to cause trouble.
No,
Yes, it is.
I will tell y'all that we have had multiple debates. We have had multiple debates about the mission statements. We really have. And I think it's difficult. I mean, we've had a tremendous amount of input, and that's why we sent it to you guys, because we want your input too. And it is difficult to narrow down everything we do and our purpose into one sentence. But we know that the college and career ready piece needs to be in there, because that is our objective. That's why they're with us. They have to be able to do something when they leave us.
You don't want them on the welfare rolls, you don't want them sitting under no.
That is our purpose.
Have career.
Yes, sir, Mr. Hine?
Can I take a run at this?
Absolutely.
Our mission is to educate all students in a safe environment and to graduate them ready for college or careers.
Now there you go. That sounds good there.
Active voice, always go back.
Keep it up.
Oh, you even wrote it down for me, thank you.
I got this into
Do y'all like that?
I like that better.
That sounds.
Our mission is to educate all students in a safe environment and graduate our students ready for college and careers. Ready for college or careers, or.
Yeah.
It's a lot better than what it was.
Yeah.
That's a whole lot better than what it was.
But that's just
I
my
like
opinion.
it.
How about
Educate our
equip
students.
and equip our students for college and career success? And equip our students.
Oh, you're going too far.
Too big of a, too big of a.
All right, so our mission.
I'm trying to get success.
Too big of a
Or,
word.
okay, or.
Our mission is to educate all students in a safe environment and to graduate our students ready for college or careers.
Much better, much better.
Y'all feel
Did you
that?
say graduate them in the original? Graduate them versus our students twice? Our students is in there twice.
Yeah, that's redundant.
Yeah, we don't need.
That sounds like a better sentence.
That's redundant, attorney.
I think you said them when you said it all out.
And I'll tell you that a lot, I mean, we have charts just on words. We have charted just the adjectives. We have charted this stuff to try to take what everybody wants to put into it. So we will continue to work on that. Our mission is to educate all students in a safe environment and to graduate them ready for college and or careers.
Well, ready for college or career success.
I like it. I like that. Successfully.
And let me
That's
say
for
this.
those teachers in high school.
Sounds great.
I mean, let me say this.
And I say this, from this day forward, from this year forward, we will annually review the strategic plan. And so as the verbiage changes from either race to the top or DOE, and the priorities change, and I think our focus will always be the same, it's safety and making sure students are successful when they leave us.
But this is a living document.
It is a living document, it will be a living document.
One thing that is helpful about having it be more concise and focused in on those key terms, we know safety is a priority for us with college or career, college or career. One of the things that we're seeing with our students is that they don't necessarily want to go to college, but they're not ready for a career. So if you go all the way back down to kindergarten, and they're underperforming on state assessments, and they reach middle school, and they're underperforming on those same assessments, and then you look at our equity report, which we've made progress, and we have certain groups of students that are not graduating ready for college or career success, that is a major issue for our system. And so they walk the stage, some of them, and then they sit. They sit in our communities, and they don't go out to work, or they're not eligible to work for anything other than a low-wage paying job. So even though it seems idealistic to go all the way back to pre-K and K and think about college or career, if they don't have those skills by the time they get to middle, they're not going to be eligible to take Algebra 1 and 8, and we know those students do better when they go on to college. We have all the statistics. It's their educational path that we're concerned about when we think about college or career, going all the way back to K. And the gap increases, those that are not on grade level in third, as the gap increases, the likelihood of being prepared is less over time. And that's why we wanted to include those key terms, going all the way back to pre-K.
That's the reason why the draft needs to come back.
What's that?
That's the reason why the draft needs to come back.
That's another way to get those skills, and that's what I think Carol mentioned military.
You know what you're talking about, they graduate from high school but don't have a real plan?
That's it, yeah.
Marine Corps can give them a plan.
And you know what's getting harder and harder to get in even to the military as they cap their numbers. You've got your online schools that are saying we don't want that online degree. You have got to be qualified being, and then you take your ASVAB and they're not ready to do anything other than whatever field that they qualify for. So all of it comes in. Sorry. Just wanted to flesh that out a little bit. So that's the thinking that was behind some of it. We were going to present a document, a college or career readiness document, but I think that just having the conversations helps. Thank you.
You're welcome. Thank you for your input. We do appreciate it. Like I said, it's really been, there's been a lot of attention and eyes and input into this document, but it always takes fresh eyes. So that's a good thing that you are looking at this today.
And I think sometimes I give the impression that I hate college graduates, but I don't.
No.
But I also look at some realistic things.
And I agree. I think a lot of students do turn off. And what we really have to try to teach them is they have to understand they're going to have training beyond high school. And that training will always be continuous. They are not going to be able to get one job and keep it forever, because you constantly have to be trained. I mean, constantly. I never thought in my wildest dreams I would be writing grants. I mean, that just was never part of, and there are other things that sometimes, come into your world that you just never thought you would be doing. You have to turn around and get trained for it. We all know that. And I think that's what we have to teach our students. And that's the whole point behind the Common Core standards, and making sure that they can be problem solvers and they can be critical thinkers, and that they have to have that expectation and that understanding that there's always going to be training.
Well, I can promise you one thing, when I went to 10th grade, I never thought I'd be a school teacher for a thousand years.
All right, so the third strategic goal is skilled workforce and economic development. So again, it talks about readiness for post-secondary or career placement and some of the things that we are doing. There's a diagram there to indicate how we measure post-secondary readiness in reading and math, and some of the strategies that we are using to increase that. On page 11, that continues the exposure to an integrated, rigorous curriculum. Industry certifications are part of that workforce strategic goal, and the increased graduation rate. On page 11, under increased graduation rate, again, a fresh set of eyes. Steve George, one of our business partners, we added the last bullet based on his comment, and it basically goes back to what we alluded to earlier, is using our community-based industry and business partners to come in and communicate with our students the importance of education, and hopefully sometimes that motivates students to stay on the right path and to graduate. So the graduation data is there. And then the last one is quality efficient services. Effective leadership and highly qualified instructional personnel. Looking at the data there with reading endorsements and highly qualified. The last page 13. Under quality efficient services is the fiscally responsible long-range planning and resource management and the continuous evaluation of support systems and services. Seeing that we will annually monitor this plan and we can always go back and continue to work on mission statements and strategies. The strategies will change. And then the last one is the safe and healthy facilities. That ties to quality efficient services. So this encompasses a lot of pieces from our district improvement plan. It covers the state strategic imperatives, those 4 state strategic goals. It will tie directly into what we're doing with district accreditation. I'm not, we really would like to move forward and post this to our district website as soon as we are ready to approve the strategic plan, and that approval will come from this board.
Can I ask you another question on, go back to page 12?
Yes, sir?
Would it not be, what do you think that added a statement there about professional development? Will provide professional development? Or something, I don't know what the correct wording is.
Yes, sir.
It may not be necessary, I don't know.
I think it's excellent thought.
And you know what, we did have, do you remember, Candy, we did have some data in here about the hours of professional development. We actually did receive from the state data on the total number of hours that our employees participated in professional development. But we were afraid to include that as a data chart because we don't know if the state's going to continue to provide that data to us.
I don't think excuse me about it, thank you for you, but you weren't thinking about a data search.
No, sir.
Just a
You were
strategy.
thinking about a bullet.
A bullet that says that our county, we will provide, the top notch or however you want to professional development for all our instructors and employees or however employees probably better.
High quality instruction for our
I'll continue to provide.
Yes.
That's excellent. Thank you. Thank you for
The district will continue to provide high-quality professional development for
If you don't think it's necessary, don't put it in, but I think.
To meet the needs of all students, it's professional development for our students. And for our teachers and for our students.
And all our employees.
And all.
Because, like this, when he's bus driver, just tell with his maintenance people, that's supposed to be top notch.
The district will continue to provide high-quality professional development for all personnel to,
Also to meet the needs of all students.
that's why I had to meet the needs of all of our students, but I didn't know about the word meet. Okay, the district will continue to provide high-quality professional development for all personnel
Yeah, I'm going to go with it.
to meet the needs of our students. Okay. Did anyone else have an opportunity to study the document from last that you received to provide any further input?
And just make a couple comments too about accreditation on this. I do have the external review team logistics, and it does tie into this document, so I'll pass that out for you. I'll be very brief on this.
Don't we need to change your name on this here steering committee? Ms. Carroll?
Yeah, I'll do that.
We'll talk about that one day.
In regards to the strategic plan and district accreditation, the external review team will ask you questions about the strategic plan and how it fits into our district accreditation process and standards. And so I wanted to share with you at the same time that we presented the strategic plan that on that Monday, the 14th, they would would like to interview board members, to ask you questions about district accreditation and the 5 standards, which in our next board meeting will provide an overview of everything that's happening with district accreditation to prepare for that meeting. But the strategic plan directly ties into our mission, of course, our purpose, our vision, and what you do as board members with policy. Because all of our policies should align with our strategic plan, and our vision and our purpose. So I wanted to hand this out to you today because it does require some planning on your part, and some of this, the accreditation team provided this to us. I sent this out a couple of weeks ago, so if you have any questions about it.
What time on the 14th?
I think it's going to be mid-morning, but I'll get you the specific time sometime today, hopefully.
So you're saying that you want us here on the 14th?
16.
I had down as a special call meeting on the
The
16th.
14th, they would like to interview board members on the 14th, and they would like to have an external review meeting on the 16th. So the interviews are going to be about 45 minutes. I can try to schedule in a specific time for you so that you can come and then leave. You won't have to stay here all day. It'll be a specific time. And I'll work with Mr. George today to get that the exact time so we can schedule that.
I know you want to turn it
Now, I will say
They
that,
look to schedule Ms. Brookins at 5:30 in the morning.
okay. I know that it's a challenge, and like Mr. Hastings said yesterday, this happens once every 5 years, and I know it's a challenge for all of us to try to get all these documents in. I will say that our schools have probably spent close to 200 hours on this project, and I know our county offices have spent enormous amounts of time on this project. Mr. Hastings will attest, so we want to have a good strong
meltdowns.
So this will be our opportunity, the board's opportunity to convey your understanding of the standards and how it impacts your work.
So you're going to try and get us a completed one of these things before October the 14th, is that what you're trying to say?
I'm going to try to get you one before the end of today, possibly the next one. For the actual times. I'll have it all graphed out for you, so you know exactly where.
They want all board members, they just want to pick a few.
If they will.
I'm not moving Brookins for that job. You see that thing,
And we'll go over all the other aspects of accreditation in our next meeting, all the data, self-assessments, all the diagnostics, stakeholder feedback. A lot of positive things. We've learned a lot. Learned a lot about our district.
It's been good overall.
And just to follow up, so you had an opportunity to provide input in the strategic plan in the past, right? We will make the corrections and additions based on your recommendations, and then we will bring this back to the board at the next meeting.
Sounds good to us.
And feel free to continue to review and send me any other comments. Except for Mr. Philpott.
He wasn't paying attention.
That's why I said.
I heard what you said. You continue to review it. If you have anything, change it, let me know.
You're good. That's all those years of teaching it.
I can multitask.
All right, we're going to move on to item G if you two are done.
Thank you.
With Ms. Tyson and Mr. Bryan. I'm just
Good morning, Mr. Hastings, Mr. Chairman, and school board members. I'm happy to come before you again today. First of all, I distributed our little brochure that's hot off the press. Last time it was just a draft, but I wanted you to see this. And also, as you noted this morning, we've heard that we've gone beyond the realm of in academia, reading, writing, arithmetic, and now we are going into the realm of recycling. Reuse it, reduce, and recycle, the 3 R's. And that's in line with our vision for Lee County students when it comes to food, nutrition, and wellness, our focus and our legacy. And what better legacy to leave them than to recycle what we use. And with that, I will let Mr. Lee Ryan speak to you. We started a pilot program in 2 of our schools last year, which proved to be very successful. And this year, based on our studies that we did, we decided to extend that to 8 of our schools, and it has been extremely well received. And with that, I'll let him talk to you about our Flip It, Smack It, and Stack It program.
Give you an idea of what the machines look like for those of you who haven't seen them sitting behind your schools. Thank you. Thank you. You've probably seen one. Yeah. Joe, you need a picture? For those of you that don't know me, I want to thank you for inviting me today and let me come speak to you about our recycling program. My name's Lee Bryan, and I live at Fowler Bluff. I'm a resident of Levy County. And we have a company called Styro Green Recycling. And we're recycling the styrofoam food trays that children eat off of at their schools, at your schools. And we started about 3 years ago in Georgia. And we started looking at where we would go to recycle styrofoam. And we found some densification equipment. There's been a lot of it on the market over the years. Actually, in 1972, some of this type of equipment was invented, but back in 1972, nobody was green, and nobody was interested in recycling, certainly not styrofoam. Most of what we had back then was paper. So we looked at the densification equipment, but by using the densification equipment as as a waste reduction tool, it still gave us no recycling option. So we started the program as a reduction system, but then, of course, the first thing everybody wanted to know was, what are you going to do with the material? So we started looking at our options for the material, and then we started looking at where to get the material, because you had to have a point of separation to get the material out of the waste stream before it got in the waste stream. So the schools became our target market because the children could separate the food from the tray and get it out of the waste stream before it ever got in the waste stream. Because once it gets in there, you're not going to get it back out. So that's the reason we have went after the schools, and they've been basically through school nutrition, this styrofoam recycling movement has been taking shape across the country here. And we now have about 7 different distributors representing 20-something states. So we have somewhere around 350 schools from California to here doing the program. And what it amounts to is the children, we come into your school system, we put up these signs in your cafeteria to make the children aware that there is a program going on. Then the children come up to these stackers sit in the cafeteria beside the trash cans. The children walk up to the trash can, they flip their plate over and they shake the food off of it, then they put their tray in this slot. At the end of the day, the custodians or cafeteria staff, it may vary from school to school, they take this stacker here and roll it out to the machine that is placed behind your school. And they take them out and load it in the machine and turn it on for 6.5 hours when they leave for the day. And the next morning, it has reduced all the trays from the day into this block. This represents about 800 trays roughly. So it is a pretty good waste reduction tool. It cuts your waste stream bag count in the cafeteria by 50%. So you're putting less bags in the dumpster, you're handling less material. So this machine there's a lot of waste reduction equipment out there, but we're very proud to say that we tried a lot of different things to get a recycling option. And we tried crushing this material and putting it in concrete. We tried burning it for fuel. I had Emerson Columbia look at it to use it for a fuel source in their boilers. There's a lot of rules and regulations in this country that won't allow stuff like this. So what we've done is we have taken these blocks finally, and which I think came up with one of the best solutions for the material that we could have ever come up with, just through chance, really. I was actually contacted by a company from China that's the largest recycling company for plastic, cardboard, everything in the world, Intco Recycling. And because of a website, they contacted me on my cell phone, believe it or not, directly. And so I shipped them one of these blocks, and they sent me back that it was too contaminated with food product. And that's been the challenge with recycling styrofoam across the country up to this point, because there's two companies in this country doing clean styrofoam, but nobody's doing dirty styrofoam. And we're the only company that in the whole country that is doing a recycling program with dirty styrofoam. And so anyway, after about 6 months, they contacted me back. And in the meantime, I was looking at other options. So they finally figured out a way in about 6 months to filter this material and clean it up and be able to use it to make picture frames. So now we have, those of you who've probably already seen some of them, but we've been able to make picture frames. You can pass them around and everybody take a look at them. But those of you who don't already have one, we felt like that this picture frame option is probably the least likely item that will ever make it back to the landfill. It'll hang on the wall somewhere, and and it'll be there for years and years. And we're very proud of this recycling option, and we're also very proud to be the only company that has closed the loop on recycling styrofoam. Nobody else has a program in place. There is other reduction equipment, but no other company. We are a single source as far as having a recycling option for the styrofoam into these picture frames. And I'm proud to say that yesterday in King Howard, Georgia, a school tried them at a parent-teacher night as a fundraising option, and they sold out in about the first 20 people that came in. They sold every frame when they explained the program at their parent-teacher night. And so we are offering these picture frames to be used as a fundraising option at your schools. We'll have them available here within the next 2 months. We'll have plenty of them. I made one order to get everything in place, and we have our importing deal in place now from China, and we'll be able to have as many as we need from now on. So I'm very proud that Allegheny County gave us an opportunity to do a pilot program here, since I do live here, and do think of Allegheny County as home. And it worked well. The schools seem to be taking right to it. We haven't had any problems. We did have one breaker get turned off accidentally over here in Williston, and then we did have a couple of cafeteria people that thought they could put the trash bags in there with the styrofoam trays. But we've got all that squared away
Said
now.
he thought he smelled a chicken leg in
Well, they do complain about mashed potatoes, and Miss Catherine over here this morning said it does make her hungry for barbecue when she smells it in the afternoon. So, but the machinery does not give off any VOCs or any kind of gases like that. We've had that all checked already. The machine doesn't get hot to the touch sitting behind your schools. There's no danger of anybody getting burnt from it, unless you wanted to take an unruly child and put him in it and melt him down. So, but they operate at 450 degrees, which is the same temperature as your oven in your house. So, and two, your employees are handling this material when it's cold. The machine has cooled down the next morning. By the time they come back, it does its job while y'all are sleeping and everybody's gone. The next morning, the tray is pulled out, it's flipped over, and this falls out. And once a month, we come by and pick these blocks up. And then we accumulate 40,000 pounds. Right now, we have a storage facility here at Fowler's Bluff and one in Georgia. And when we accumulate 40,000 pounds, we call them the company in China. They send a container truck, and we load it, and 5 days later, it's there. I mean, we get paid for it, then it's about 30 days to get it. So we're making enough money off of the recycled material right now to pretty much pay for picking it up and transporting it, and getting it collected and loaded and everything. So hopefully in the future, we get a little more value to this block. We may be able to even lower the price on the machinery or the rental cost, or even offer the schools some, rebates.
What is the rental cost on the machines?
Right now, you're paying $350 a month. And through the pilot program, we assess that, the savings from washing dishes and running your dish program is more than pays for, going disposable and the recycling program.
We looked at it, and once you factor in the detergent you're not using, and the hot water you're not using, and the employees that it costs to run the dishwashers, and electricity, so, it's revenue neutral to the board.
Plus you can reduce the tonnage of the waste.
Garbage waste.
Yeah.
Garbage dumpsters, those things are very expensive.
Very, I think that's a big plus. Yeah.
Most of your savings, I've done, because Miss Becky allowed us to use Chiefland Elementary as a place to do our research and all, and Brenda did a real good job. We were able to compile some figures, and I can give you all those as well. Most of your schools nowadays are not, your new schools and everything are not even putting dish rooms in. And most of the reason for that is the cost of the dishwashing equipment and the operation of it, but also for health concerns. Because a couple of my schools in Georgia went totally disposable strictly for health concerns. Because of the dishwashing equipment not getting hot enough, the water or the chemicals weren't dispensed properly or whatever, so they went totally disposable. And got away, they found MRSA and hepatitis and everything on their dish, their tray. So, but aside from all that, it is a financial savings, and when you reduce your tipping fees as far as how many times a week you dump your dumpsters, and I know that's a big issue, garbage disposal has always been a big, expensive problem. So, when you go disposable, you can, by using a waste reduction program, and then adding the recycling aspect of it too, it really does close the loop, and it makes it a sustainable program, something that it's not just a feel-good program because everybody's participating here. The children are doing their part. The school system is doing their part by installing the machinery, and then we're doing our part to recycle it into a usable product. So it is a good program that will sustain itself. We're very proud of the job.
How many districts are you in?
We're in about, district-wise, it would probably be about, probably about 11 in Florida, and then about 12 in Georgia. We have 65 schools down here in Florida and 35 in Georgia right at present. Then we have 70 in Arizona, about 80 in California. We have 14 in Texas. We just put one in Mississippi. So, there was a group of us that started this program through a different company. And the company's equipment did not work properly. So after a lot of trials and tribulations, we worked on the equipment and got it fixed in Georgia. And then we started manufacturing this equipment in Adel, Georgia, which is right here where I'm from up there. And we built our own. And so all the distributors that were initially in this program that bought protected territories, they came over to us and we started being their manufacturer. So now it's gotten grown, and I couldn't handle manufacturing and working in this type of role as well. So one of our people that was in the recycling program in North Georgia had a restaurant making or manufacturing facility in Atlanta. So we have turned the manufacturing of the equipment over to the company in Atlanta now, so they are being built here in the United States. And we are in the process of developing a home model, a residential model, that we're going to pilot here in Gainesville in a subdivision that will, if we can see if we can densify this material at the home, and it can be placed in your recycle bin, and then it will be picked up by the waste company, and then we'll purchase it from them, down the road. So we're still moving forward, trying to figure out different ways we can collect the styrofoam.
Thank you, Mr. Brown.
I don't feel like it'll ever go away, but I think it's part of our culture and our lifestyle. It works good and it's cheap and something that we all use every day.
Thanks,
If
sir.
you guys got any more questions? Thank y'all for having me.
Thank you.
Thank you for using the program.
Yes, sir. All right. Yes, sir.
I have a question for Ms. Becky. We're about a month into school. How is our school lunch program and our a la carte? How's that?
Going great.
Our figures covering what?
Preliminary figures are above last year. I don't have a definite today. I just did our August claims, but it's above last year. And our a la carte hasn't really kicked off yet. It kicked off in September.
Right.
So I should know even something more by the end of September, and I'll let you all know.
Has everyone had a chance to read over the minutes? Oh, sorry.
The only thing I've heard about these things, Ms. Becky, is that some of our kindergartners cannot put it in that tray, cannot put that tray in that machine. So it takes them adults to do it.
Well,
So that's the only complaint I've heard about that.
well, I'll check into that. We do have aides in the elementary level that are assigned to help the kids, but we'll check into that.
Okay.
Okay.
Now, to answer your question, Mr. Philpott, some of your schools, they are not even using these. And it depends, I mean, I have tried to explain different ways of collection in the cafeterias. Some of your, on the pre-K and your smaller children, the aides, like Miss Becky says, they'll roll a cart along there and let the kids just stack them on a cart. And then they roll the cart to this, and then the aides will just take the whole stack and put them in here. So there's several different collection systems being used, and I have some schools that don't even use these. They just stack them on the end of the table. The custodian comes by and picks them up at the end of the meal period. So, you know, it just depends on different schools and how they get their little system going.
That really truly, that machine makes styrofoam greener than paper. Basically, would that be what we're trying to say here? But, you know, McDonald's, they don't use styrofoam at all anymore.
Right.
So,
right.
but that machine allows styrofoam to be as green as paper?
It does, it does, it does, because not only are they building picture frames out of this, they're making crown molding and baseboard stuff. So there's a lot of other things being looked at to be made out of this material. So I think in the future that you will see, since we do have a recycling option for styrofoam, now it is just as reusable and just as green as paper or plastic or anything else. So it's just that styrofoam has been the last thing that has been looked at because it's the hardest to deal with. They make it into beads, and I know y'all are familiar with how they make all this. But we're not able to get this stuff cleaned up here in this country. But China is so hungry for raw material, they figured out a way to clean this because our people like Genpack and Chris knows, these people that manufacture these styrofoam meal trays and everything else, it's so much cheaper for them to use a brand new product here in this country. But in China, they can reclaim this, and they're making all kind of different materials out of it. So I think in the future, the more awareness, and it's being done through school nutrition, believe it or not, across the whole country, is actually how the styrofoam is being recycled and how people are being educated to it, really. So, and I think it's a wonderful thing that school nutrition is being recognized for that.
Thanks, sir. Before we move on to the minutes, we've been asked for a point of conference, and we have a 5-minute recess. So everybody take a break. We'll be right back.